So why are we so interested in neutral spine, in bone health? Doesn't the spine need to move in all directions? Yes, the spine does benefit from moving in all directions. We just need to be knowledgeable about how to do this safely, without excessive strain or force, especially if we've been diagnosed as having osteopenia or osteoporosis. We have two types of bones in our body. Cortical bone forms the external layer of all bones, but it is found predominantly in the long bones of the arms and legs. Cancellous, which is also called trabecular bone, is found at the ends of the long bones and in the vertebrae. When we have osteoporosis, we are more at risk of fracture where there is a predominance of trabecular bone. That is the hip, wrist, shoulder, and spine. Women and men alike begin to lose bone in their mid-30s. As they approach menopause, women lose bone at a greater rate, from 1.5% to 3% a year. Let's focus on the spine now. From this picture, you can see the trabecular bone in the body of the vertebrae has become more porous. If excessive force or load is placed on the front of the vertebrae, there is a greater risk of fracture. This diagram shows the spinal loads or compressive forces on the spine when in different body positions. Notice how the loads are less in lying and then progressively greater in standing and sitting. In each of these positions, there is also less load on the spine when it is in neutral compared to when the spine is excessively arched or flattened. You can see this in lying, in standing, and in sitting. According to Harvard Health, activities that put stress on bones can nudge bone-forming cells into action. That stress comes from the tugging and pushing on bone that occurs during strength training, as well as weight-bearing aerobic exercises like walking or running. So this is why, in order to practice safely, it is essential to be aware of exercising with neutral spine. If you're new to weight training, start with little or no weights and progress incrementally.